This is a case of full endoscopic spine surgery with PIVD at two level L4, L5 and L5S1 on left side. So I decided to start with L5S1 discectomy. So after initial soft tissue dissection, bony work was started. So drilling of cranial lamina was started with diamond drill. So cranial lamina was thinned out liberally. Then after cranial lamina drilling, the caudal lamina was also thinned out, and after eggshelling this lamina, this bony decompression was done, and neural structure was visible just underneath it. So after removing ligamentum flavum, fat was also removed so as to clearly define neural structures. So now you can appreciate traversing nerve root and sac. So root was medially retracted. So in this case, disc bulge was in shoulder at shoulder level. So this is a disc bulge. Root retractor or sleeve was used to retract root, and just now you can see the large portion of disc material that is delivered out. Then other few large fragments were also delivered out. So now root is well pulsatile and well decompressed, and this is a large defect, annular defect. So after ensuring hemostasis, annuloplasty was done because there was a large defect, so as to prevent further recurrence. Then I moved to L4, L5 disc level. So drilling was focused more on caudal lamina, because in this case disc fragment was caudally migrated. So more of caudal lamina drilling was done as compared to cranial lamina. So similarly, bone was thinned out. Now thinned out lamina is removed with Carrison punch. So now we can appreciate neural structures. Just underneath it there is traversing nerve root, sac and axilla, which is further defined, and now axilla is clearly visible. So as we know, the disc material large fragment is just lying in axilla. So in this level axillary approach is taken and large fragment was delivered out. Then hemostasis was achieved, and we can see there was a large defect. Now we can see traversing root and sac at L4, L5 level is nicely decompressed, as well as good decompression is achieved at L5S1 level also. And this is axilla, which is totally empty, totally decompressed, no fragment left, and this is significant amount of lamina which is still there, which is, I think, the beauty of monoportal endoscopy, by which you can address both the levels with single port and still preserving a good amount of lamina So this is single port, which is of course just less than a centimeter. Thank you.